Do you have a bunion and think your only option is surgery? Make sure you watch this video. I'm going to give you a great alternative to surgery, and I'm going to take you through the bunion surgery versus conservative management. And so make sure you watch this whole video because I'm going to show you examples before and after x-rays of people that we have helped through conservative management approaches and help them avoid the need for bunion surgery. My name's Daniel Fitzpatrick from Sydney Foot Solutions. We see stacks of bunions on a regular basis. In fact, we probably see well over 100 bunions a week for ongoing treatment and management. You can actually really help a bunion without surgical intervention. The reason I make these videos is that people don't realise that there's a non-surgical treatment that you can do for most bunions. So what I would encourage you to do is seek professional advice sooner rather than later so that you can avoid the need for surgical intervention. I'm going to take you through your options and give you a little bit of insight what's involved if you do go down the surgery path, but also show you an example of a before and after x-ray that we successfully treated without the need for bunion surgery. I'll give you some great tips on how you can avoid bunion surgery, particularly if you can't get into the clinic or can't come and see us. We do have a very special offer if you do have a bunion, so make sure you watch all the way to the end or click on the link below where we've got a 60% off initial bunion assessment where you can come in and get professional advice individual to your needs about your bunion. So just for the records, this is somebody that we have seen after the bunion surgery. This is their x-ray, and you'll notice that what you can see through this area here is we've got some fairly significant screws and plates. You've got to remember that if a bunion gets bad enough, when they do the bunion surgery, they have to break, and then they have to go and pin everything and then cut all of this back. So the reason it's such a significant recovery time, usually at least 6 to 8 weeks off your feet, often the surgery charge is upwards of about $7,000. So it's quite expensive to get your bunion operated on. Keep in mind that most bunion surgeons are so busy, they're not overselling the bunion surgery. So they're not doing it unless it's indicated. But the key is that you need to intervene sooner rather than later. So if you leave it, the problem is your only option will be surgery. And so one thing that I do hear all the time in the clinic is I hear, but my bunion doesn't hurt me. And the problem is if you don't do anything proactively about it, you give the bunion a chance to cause wear and tear through this area. What's been well documented is that you don't really feel the first 90% of most degenerative and inflammatory responses. And so the problem is that the inflammatory response is building underneath the surface and really flares up and goes crazy. And then once it does, sometimes it can be too late to intervene through. What you can see is this individual that has come to see us has had a big toe pinned. The bunion no longer hurts her, but sadly, within 18 months of the bunion surgery, she's now got herself a Morton's neuroma through this area here. And what a Morton's neuroma is, it's an inflammatory response to a nerve through that area. And the concern is that when you fuse a joint, the rest of your body has to compensate and make up for what is going on through there. So it's really, really important that, yes, the surgeons do an amazing job when they do it. Significant recovery time, very expensive. And, you know, the reality is that you're probably going to be off your feet for 6 to 8 weeks. So definitely take that into account. If you can't afford to be off your feet, then bunion surgery is not a great option for you. And also, it's often 6 to 12 months before the swelling even stops from the surgery. Because you've got to remember, they've got to go in and traumatize all of this area through here. So it's really, really important that you take that into account. Now I'm going to go through a case where we actually successfully treated a bunion and then we helped to avoid the surgical intervention. And so this is a girl that we did treat. And so this is the before and this is the after. And this took roughly 12 weeks to achieve. So the ideal reading for a big toe should be between 10 and 15 degrees. And not am I saying that our treatment process is perfect, but usually in most cases we can avoid the need for surgical intervention. And so when she attended for her left foot, this is her before, she was about 35 degrees. So she had a 35-degree angle like that. The ideal reading should be about 15 degrees. So anything over 15 degrees, you have a bunion. So 35 is a reasonably advanced bunion for what we see. We treat everything up to 50 degrees now, conservatively. So once again, if you have any hesitations or you're not sure, always get checked out sooner rather than later by a professional. That way you have more options. I'm not saying anything's perfect, But the reality is you will have way more options if you go and get an opinion sooner rather than later. And then so what the treatment process that we did was a gentle hands-on technique, and then we used exercise to support those changes, and we worked on actually improving the alignment through the big toe, through this area here, but also improving function through the rear of the foot, where the bunion was actually coming from as well. And I was really happy to report that we got it down to 16 degrees. Now that's a really, really good change. It's almost 20 degrees change just through very gentle hands-on technique and exercise therapy. So, and the great news is the cost was about a tenth of the surgery. The cost was very minimal comparative to surgery. No downtime. The person could stay active, keep doing whatever they want to do, can wear a variety of footwear, don't have to be in orthotics. In fact, the changes are actually intrinsic, and we strengthen and realign the foot as well. So, needless to say, as you can probably tell, a pretty good response. Where the patient was very, very happy. And in most of the people that we do treat through a conservative management approach, 90% of cases don't ever need to consider the surgical intervention. So needless to say, a very favourable result. And so what I would say is that if you do have a bunion, I would go and see a podiatrist, because podiatrists tend to be more from a conservative management approach, and seek a professional opinion. In fact, it's anywhere from 100 to 150, depending on how busy we are that week. So we see stacks and stacks of it, and we have done for over 20 years. If you are in our area, or you are in Sydney or New South Wales, and you would like an opinion on your bunion, make sure you check out the link below. We've got a 60% off initial bunion assessment offer, just so people can come in and get expert advice individual to their needs. We may need to send off further scans, and they may be indicated, but it's definitely something that we would recommend sooner rather than later. I hope the video was helpful, particularly if you have a bunion. If we can be of any further assistance, please don't hesitate to let us know. If you like the video, like the video. Keep in mind, if you subscribe to our channel, we release 2 videos a week where we try and promote good foot health and help you improve your health.